Imagine an 8-year-old girl, a little child, who should be playing, learning, smiling, but instead she's battling something that most adults can't even handle. She leaks urine every minute of the day, not because she's sick with malaria, not because she gave birth, but because grown men forced themselves on her. Doctors confirmed that she has Vesicovaginal Fistula, VVF. But how? She's only 8? She's not even pregnant. She's not a mother. So what happened? Let me explain it fully, because many people don't really understand what this condition means. VVF means there is a hole between the bladder and the vagina. Because of that hole, urine leaks continuously through the vagina, day and night without control. In a normal body, urine flows from the bladder through a small tube called urethra, then comes out when you go to the toilet. But when someone has VVF, the urine finds another path. It leaks straight from the bladder into the vagina through that unwanted hole, and the woman or girl cannot control it. She can't stop it. And listen please, it comes from the vagina where menstrual flow passes. That is what makes it different and more painful. To make it simple, imagine your bladder as a water tank. Normally, water passes through a pipe, that is your urethra. But if the tank cracks on the side, the water starts leaking where it is not supposed to. That is exactly what happens in VVF. Now, let's talk about the little girl. She didn't have a baby. She didn't go through labor. So, how did she end up with VVF? Because her body was injured when an adult man or older boy forces himself on a child. That child's organs are too small and too delicate. That violent act can tear the thin wall that separates the bladder from the vagina. That tear becomes a fistula, a hole. Just understand it that way. That lets urine leak non-stop. It is not about how long the manhood is. It is about force, pressure, trauma, and at that age, her pelvic tissues are not strong enough to handle such acts. That is how it can cause VVF, even without pregnancy or childbirth. VVF doesn't only happen to children. It can also affect adult women. Here are the most common causes with short explanation. Prolonged or difficult childbirth. When a woman is in labor for too long and the baby's head keeps pressing on her bladder, the pressure cuts off blood flow to the tissues. Those tissues die and form a fistula, a hole, days later. Now listen, some women, when doctors say you need a C-section, they shout, "God forbid, not me." But my sister, are you wiser than the doctor? A trained health professional, they are not trying to harm you. They are trying to save you and your baby. Refusing a CS during a dangerous labor is one of the main reasons women end up with VVF. So another one is surgical injury. Sometimes during womb or fibroid operations or even C-sections. So yes, the bladder can be injured accidentally, leading to fistula, hole. So another one is radiation treatment. When women undergo radiation for pelvic cancers, the strong rays can weaken and destroy the tissues, forming hole over time. Another one is severe infections. Certain untreated infections in the bladder or vagina can eat into the tissue and create a hole. So another one is safe abortion or harmful traditional practices. Rough or unhygienic procedures can damage the womb or bladder. Another one is cervical or bladder cancer. When cancer grows in these areas, it can destroy nearby healthy tissues and cause a hole between the bladder and vagina. In all these cases, the result is the same. A hole forms and urine leaks continuously through the vagina. Now, women with VVF face rejection, shame. People avoid them because of the smell, but they forget it is not their fault. This is not a cause, not a spiritual problem. It is a medical condition that can be treated. Surgery can close the hole and stop the leakage, and doctor will prescribe a medication to help her body heal properly. And yes, of course, hygiene is very important. Counseling, love, and support can restore their confidence. And for those that caused by abuse, the abusers must face justice. Or what do you think? Every child deserves safety and protection. Please, let's stop the stigma. Let's educate. not judge. Let's protect every girl and women, especially those in rural areas who don't even know what VVF is. No woman or girl deserves to suffer in silence for something she didn't cause.